Hello, I'm Kat Draper. I work for the Cystic Fibrosis Trust. We're here today with Alex, mum of Wilfie, and Fiona, who's a CF dietitian, to talk about breastfeeding with CF. Obviously, breastfeeding is a very personal experience and a personal decision for everyone. But Alex, would you like to take us through your experience of breastfeeding?
Yeah, I didn't really have a plan in mind when I was pregnant. I was quite open-minded and flexible to how things would have gone. We were able to breastfeed for 6 months, but it wasn't an exclusive thing. We did combi feeding with expressed milk and formula, and so my husband and I were able to share the load a little bit.
And did you have to make any changes to your usual routine?
I mean, everything changes when you have a baby, doesn't it? So I think that was the biggest thing, that I realised that I could still get everything done in my day, but it would just be on a new timetable, and that was on his timetable to start with. And they nap a lot when they're very small, so I used to make the most of that time to do my own things. And then, you know, I do remember people joking about how you need lots of cake when you're breastfeeding because you need that extra boost, but it became a necessity. Like, I needed cake every day.
And Fiona, in terms of breastfeeding when you have CF, what can someone be doing to add those extra calories into their diet?
So breastfeeding can burn an extra 300 to 500 calories per day, so including extra kind of nutrient-dense, high-calorie foods is important. So things such as avocado, adding extra cheese, cream, butter, oils to your meal. If your appetite is low or you're struggling to fit in extra snacks and meals around all your treatments, really just going for your favourite foods is the most important thing. So not holding back on things like cakes, crisps and dips, donuts, whatever you fancy, because at this time keeping a healthy weight is more important than how healthy your diet is overall.
Is there a recommended period that CF mums should be breastfeeding for?
We wouldn't really recommend any time period. If 7 days suits you and baby, fine, brilliant. If 7 years suits you and baby, fine, brilliant. The NHS recommends that all mums feed for 1 year and beyond, and the World Health Organization says 2 years and beyond. But really, every feed you can do, particularly at the beginning, is a great kind of first gift for a baby.
Alex, did you find your CFRD impacted your breastfeeding at all?
During the pregnancy, it was quite a lot of work to maintain and manage the diabetes side of things. And as the 9 months progressed, so did the need for extra food and extra insulin. And then all of that suddenly just stopped the moment I'd had the baby, and it was a big adjustment that happened quite quickly. I had to go back to normal again, but normal was 9 months ago, and I had trouble to kind of remember that. And, you know, needed to have lots of extra snacks and things, but not as much insulin, so there was lots of changes that I'd had to do.
Fiona, do you have any tips for mums who might be finding it hard to fit their treatments in during the day as well?
I think really the most important thing is probably learning to accept help from other people. So if help is offered, take it. People don't have to be able to feed the baby to help you out. They can help with cleaning, they can help making meals for you. Using online shopping and online grocery shopping in particular if you're not getting out. Or if there isn't really anyone around to help, the cleaning can wait. Ask your partner or a family member or a friend to help you maybe set up your treatments earlier in the day. And then as the baby gets a little bit older, as you get past the first few weeks, maybe using nap times to help kind of prepare yourself for the rest of the day.
Can CF medication affect a baby through breastfeeding?
I think it's important to talk to your CF team and check which of your medications are compatible with breastfeeding. If you attend during your 3rd trimester of the pregnancy, you can make a plan with your CF team of which medications you can use if you're planning to try breastfeeding, and what alternatives might be possible if your usual meds aren't compatible.
Fiona, if breastfeeding isn't for you, if you want to not continue with breastfeeding, what's your advice for those women?
In theory, donor milk is the next best choice, but practically in the UK that may be quite difficult to access. First infant powdered milk is all you need for the first year of baby's life. It should be cow's or goat's milk based, and there's no need for things like comfort, hungry milk or a follow-on milk. If you feel like your baby does need a specialist milk, I would encourage you to speak with your GP first.
Thank you so much to Alex, Fiona and Wilfie for their help today. If you would like some more information, do speak to your CF teams. Thank you very much.